So you're pregnant and you're getting headaches. It's not just uncomfortable, it can be pretty worrying, right? But what if you knew exactly what to look for? In this explainer, we're going to break it all down so you can feel confident knowing when a headache is just a headache and when it's time to pick up the phone and call your doctor.
First things first, if this is happening to you, please know you are not alone, not by a long shot. More than a third of all women get headaches during pregnancy, so just take a breath. This is a super common, shared experience. And here's the good news. The vast majority of these headaches are totally benign. That's just the medical way of saying they aren't a sign of anything dangerous. But, and this is why we're talking about this today, a small number of them can be a signal that something else needs a little attention.
Which, of course, leads to the million-dollar question. How on earth are you supposed to tell the difference? How do you know which is which? Well, that is exactly what we're about to get into. We're going to give you the tools you need. It all starts with a really simple but powerful idea. Every single headache, whether you're pregnant or not, falls into one of two main buckets. They're either primary or secondary. Getting this difference is, honestly, the most important first step. So here's the breakdown. With a primary headache, the headache is the main problem. We're talking about your classic tension headaches or migraines. And for a lot of women, these actually get better during pregnancy, which is great. A secondary headache, though, is different. It's not the problem itself. It's a symptom. Think of it like a warning light on your car's dashboard. It's telling you that something else needs to be checked out. That something could be simple, like a cold, or it could be something more serious. And it's those more serious secondary causes that we really need to get into. Now, the point here is not to scare you at all, but to arm you with the knowledge you need to keep yourself and your baby safe. Okay, this right here is probably the single most important rule to take away from this entire explainer. If you are past that 20-week mark and you get a new headache, you need to get your blood pressure checked. Full stop. It's the absolute first thing to do to make sure it's not related to something like preeclampsia. Now, I know a list like this can look a little intimidating, but these conditions are the reason doctors take new or severe headaches so seriously. And yes, they are all rare. But things like stroke or something called a thunderclap headache, which comes on incredibly fast and strong, are on this list. Again, this is all about awareness, not about causing anxiety. So how do you know when it's time to actually do something? Well, think of this next part as your personal toolkit. We're going to walk through the specific red flags. These are the signs that mean you should stop wondering and immediately get some medical advice. Let's start with the red flags that are especially important during pregnancy. If you're not someone who normally gets headaches and you suddenly start, that's a flag. Or if the headache just feels completely different from any you've had before. Other big ones are a headache popping up in your third trimester, one so bad it wakes you up from sleep, or one that gets triggered by something as simple as coughing or straining. And of course, if it comes along with high blood pressure or your doctor finds protein in your urine, those are major signals to act on right away. And then we have the more general red flags that really apply to anyone. A headache that just explodes out of nowhere, I'm talking going from 0 to your worst pain ever in under 5 minutes, that's a classic warning sign. You also want to pay close attention to any other weird symptoms, like a fever, any changes in your vision, feeling weak, being really nauseous, or even a headache that gets way better or worse just by sitting up or lying down. Okay, so you've noticed a red flag, you've done the right thing, and called your doctor. So, what happens next? Let's pull back the curtain on that process. Knowing what's coming can make the whole thing feel a lot less scary. Your doctor is going to start by asking you a ton of questions about the headache and doing a basic neurological exam. Then come the essential checks you see in step 2, taking your blood pressure and checking your urine. It's usually a pretty straightforward process. And only if those first steps raise any concerns might they suggest something like a CT or MRI scan just to get a closer look. All right, let's talk about some good news. What if it turns out your headache is just a benign primary type? Well, there are safe ways to get some relief. Paracetamol, which you might know as Tylenol or acetaminophen, is pretty much universally considered the safest choice for pain relief when you're pregnant. But on the flip side, it's just as crucial to know what you should avoid. Drugs like ibuprofen, which are called NSAIDs, are generally a no-go, especially as you get later into your pregnancy. That's because they can actually cause some issues for the baby. So the bottom line is, always talk to your doctor before taking any medication. Whew. Okay, we've covered a ton of ground, haven't we? We've talked about the 2 types of headaches, the red flags to watch for, and what your doctor will do. So let's boil it all down to one clear final message.
So if there's just one thing you remember from all of this, let it be this. The odds are overwhelmingly good that your headache is totally harmless. But we don't rely on odds. Every new or severe headache deserves to be taken seriously. By knowing what to look for, you're not being paranoid. You're being proactive. You're being empowered. And that knowledge is truly the most powerful tool you have for a safe and healthy pregnancy.